This is The Pulse. I'm Mike and Scott. We're talking about psychedelics and how they are being used in therapy. We heard about how MDMA can be used to treat PTSD, post-traumatic stress. It reduces people's fear reaction, so facing a past trauma doesn't seem so scary. That same quality could make MDMA useful in couples therapy, says Brian Earp. He's one of the authors of Love Drugs, The Chemical Future of Relationships. When fear responses are reduced, people feel more free, maybe safer to address things from their past that are affecting their relationships, or maybe difficult aspects of the relationship itself.
Relationships can also involve trauma, and they can also involve aspects that you don't want to necessarily get into with your partner, but that maybe you should, or maybe you want to be able to talk about, but don't know how to approach. And so insofar as you can create this feeling of safety and a willingness to approach otherwise difficult topics, that can be very helpful for some people in resolving those issues.
Now, I have not tried MDMA, but when people take it, do they feel lucid? Is it like I'm being me, but I'm being more open? Or does it feel like I'm drunk and I'm not entirely sure what I'm doing here?
As far as I understand it, the lower doses that are used in psychotherapy, you don't feel like you're blending into the walls. There are no dragons entering the room. You might have some subtle perceptual changes, so there might be a slight glow or a brightness to the environment around you, but you're certainly present in the experience. You are remembering the conversation you have with your partner, with the therapist, and when the effects of the drug wear off and you return to your normal waking consciousness, you will have been present throughout that whole experience, and you retain those memories, and you can then see about potentially applying the lessons from the therapy session into your ordinary life.
Yeah, talk about that, because I'm thinking, let's say we have a couple that is able to resolve a really difficult argument while under the influence of MDMA. When that wears off, don't we just go back to being who we were before and being annoying and aggressive and passive-aggressive and all of those things?
What people are finding is that even just a few experiences under the influence of these drugs sometimes have transformative effects. And you might think of it as something that can happen when you have a radical change in perspective. So some people describe if you climb on top of a mountain and you look out over on the city and all of a sudden you realize, well, wow, this all fits together. We're so small in the grand scheme of things. I really have a new perspective on what matters and so forth. And it's true that you can allow yourself to get caught up in the day-to-day chatter of life and forget that important experience that you had. But many people who have meaningful perspective-changing experiences, they don't want to lose hold of that insight. And so if you take measures to remind yourself of the lessons that you gained, you should be able to increase the chance that you'll be able to implement those lessons in your life. But it won't happen automatically. It requires effort and commitment.
And you found in your research that couples were already doing this, right?
We don't recommend it, but there's no doubt that it's happening. There are couples who have been, as it were, experimenting with the use of this drug for the purposes of exploring issues within their relationships. Now, MDMA is not something to be trifled with. It isn't just something that has physiological effects that fade away. It really does create an altered state of mind whereby you might be digging up some really troubling things within your own consciousness. And that should really be done with the help of somebody who is capable of taking you through the ins and outs of that without risking things getting even worse or bringing up something that maybe you aren't prepared to deal with.
Brian Earp is the Associate Director of the Yale Hastings Program in Ethics and Health Policy at Yale University and the co-author of Love Drugs, The Chemical Future of Relationships.